So you're pregnant and you think your water broke, but you're not 100% sure. So you decide to go to the hospital. I'm gonna go over some methods that we use at the hospital to help determine whether someone's amniotic sac has ruptured. Using nitrazine paper is very common. We just take a strip of nitrazine paper and we put it in an area where we think amniotic fluid is, whether it be coming out of the vagina or on a pad, or a swab can be used to collect the amniotic fluid and then placed onto the paper. Amniotic fluid will turn this paper very dark blue. Another very common test that we do is called an amnisure. We take a very long Q-tip, we stick it in the vagina to collect vaginal fluids for a minute, take it out, and we stick it in a solution for a minute, and then a test strip is put into that solution, and what it's testing for are specific proteins specifically found in amniotic fluid. Another test we can do is called a ferning test. We collect the fluids, we put it on a slide and wait for it to dry. If it creates a fern-like pattern under a microscope, that indicates that it is amniotic fluid. Something that can also be done, but is way less common, is a speculum exam. Using a speculum allows us to specifically look at your cervix and see if there is fluid coming out of it. If your amniotic fluid is just clearly pouring out of you, none of these tests might even be done. We would just call you grossly ruptured and it was obvious. I would also like to add, if you come in and they determine that your water actually did not break, it is very common for women, especially in their third trimester, to pee themselves. And there's no need to be embarrassed because it actually happens way more often than you would think.